While older people are at higher risk of dying of COVID, younger people are still experiencing serious problems. 43% of hospital patients with the virus in Colorado right now are younger than 60. Here's a breakdown from the state. The majority of patients, 57%, are 60 and older. But check out the younger groups. 27% between the ages of 40 and 59. 13% ages 20 to 39, and 3% are younger than 20. CBS 4's Alan Janae talked with a younger person who was hit hard. Alan, you wanted to know why this is happening. What'd you find?
Well, you can look at the data, Jim, or you can talk with the doctors who will tell you they're seeing a larger share of younger patients with serious COVID cases. Now, that may be because we're doing a better job of looking out for and protecting older people. But for one young woman who had COVID, it is not to be ignored. She's now a face of COVID.
I was told people my age didn't really get COVID, and if they did, it wasn't bad.
Alexa Huskin-Hobbs is 19 and shared her story in a public service announcement now out from the state.
COVID doesn't feel real in a way, and unless you've actually had it, I completely understand why it might feel like why you might feel invincible.
But she wasn't, still having breathing troubles months later.
Like if your lungs normally expand like this, it's like my lungs feel like this.
She listens to people talk about it being no big deal.
Well, it makes me really upset. I remember getting into arguments with people where they would try and tell me that, oh, COVID's just like the flu or whatever.
I think people are tired, Ellen, and people are fatigued, and people want to get back to their normal life.
Dr. Mark Moss at the University of Colorado Hospital is seeing the cases rise among younger people.
How can you explain that?
They're now the patient population that are getting exposed and infected with the virus. It's just where the virus is.
There's less of a risk, says Dr. Moss, but that doesn't mean none. Alexa knows it and knows what the things she hears can do to make the pandemic worse.
Especially like, oh, you're not going to die from this. Like, yeah, I didn't die, but my lungs still aren't okay right now. If I could, I would go back and do everything I could to never get it.
Well, if you think you're weary of hearing about COVID, and we all are, think about things for Dr. Mark Moss. He says when he comes home after 12 to 14-hour days, he sleeps in the basement to protect his family. He says he and his colleagues are physically and mentally exhausted. In Denver, I'm Alan Janae, covering Colorado First.